All right. Good evening, everyone. Welcome to this session with Mr. Lee again.
Okay. Good evening, everybody. Tonight's talk is part one of a talk on how to manage renal insufficiency. Right. This part tonight we will cover basic education on chronic kidney disease management, and we will start with the understanding the pathophysiology and progression of chronic kidney diseases. And we will also identify and manage major risk factor for CKD. And we also will talk on how to implement evidence-based strategy for slowing the disease progression. Next part of it, we will then cover the management of the complication of CKD and also apply appropriate lifestyle modification and self-management strategy for the complication. Okay, let's start. First, what is the function of the kidney? The function of kidney basically is to remove metabolic waste, toxins, and excess water and ions while conserving the need substances like glucose and amino acid. Another function is to regulate extracellular fluid volume, right, and electrolytes balance, osmolarity, and helping control blood pressure and cell function. The third function is to maintain acid-base balance by excreting hydrogen ions and reabsorbing bicarbonate. And also, kidney is to perform endocrine roles like controlling the blood pressure, responsible for red blood cell production, and activation of vitamin D for calcium balance. So, when we go for a kidney function checkup, very often we in the blood test report itself, we have an indicator that is called EGFR. What is EGFR? EGFR basically is a term for estimated glomerular filtration rate, which is a calculated value that tells how well the kidney are filtering waste and excess fluid from the blood. So in short, basically it represents your functions and filtration functions of your kidney, right? So chronic kidney disease is often defined as an EGFR rate of below 60 milliliter per minute. So you can see from this chart here, right? So this is actually where normally the chronic kidney disease has been defined. Right? The chronic kidney disease also, if you notice from this chart here, is basically divided into various stages. Healthy kidney is actually represent from a EGFR of 120 to 90. So this is actually stage 1, which is normally considered as a healthy, normal kidney function. Then if your EGFR is 90, between 60 and 90, we consider that you are having, you are in a CKD of stage 2, chronic kidney disease. And if your EGFR is 45 to 60, your CKD is considered as stage 3A. Your EGFR is 30 to 45 is considered as stage 3B, and so on until there is a stage whereby we consider as end-stage kidney diseases, and very often is considered kidney failure. At this stage is where your filtration rate, EGFR, is lower than 15. Okay, so you look at these 5 stages of CKD itself, but the prognosis of CKD by EGFR is not also a clear indication of your risk yet. We have to actually consider that together with the EGFR, another indicator, which is a measure of your albuminuria itself. So the albuminuria together with your EGFR rate itself will determine how high risk are you in suffering from CKD. And this table here, you can see from here that, right, for EGFR of CKD stage 1, right, and if you have high albuminuria, which means that your actually kidney is also having damage, you do have a higher risk of CKD. And of course, when your CKD stages increases, that means that your filtration rate drop itself. Then you can see that increasingly your risk of CKD is actually going up as well. So this basically set the stage for us to understand how to interpret CKD in the chart that is to come. Okay, how prevalent is CKD among us? CKD affects 8% to 16% of the population worldwide. Is 24% in the Philippines, 15.5% for the Malaysia, and 14.9% for Singapore. And in fact, Australia, if you look at this table here, in fact, have the lowest prevalence rate of CKD in the region. In fact, it's among one of a very low CKD rates itself. And if you look at Thailand, India, and Indonesia, their measurements are a bit different from the rest of the country that's stated here. They basically are only referring to CKD stage 3 to 5, which means that in all consideration, right, Thailand, India, and Indonesia are actually having higher CKD prevalence rate of CKD than even Philippines and Malaysia and Singapore. Okay, CKD symptoms basically increases as our kidney function deteriorate. You can see from here, at stage 1, very often, there's no symptoms. Now, as your kidney function drop to stage 2, then symptoms typically like high blood pressure and protein in urine will occur. Then if your kidney function is deteriorating to stage 3, further complication like anemia, early bone disease will occur. In stage 4, you will find that the patient very often suffering from swelling, fatigue, nausea, and vomiting. And of course, stage 5 is actually the end stage kidney failure symptoms itself. So if you look at the symptoms itself, normally those readings that we mentioned earlier are basically you can only determine through your blood test, regular testing. But in terms of common symptoms, you can see from here that stage 1 and stage 2 of CKD usually have no symptoms. The symptoms usually only occur from stage 3 onwards. And that is actually very important for all of us here to understand that, right? When the symptoms occur, which means the conditions is getting more severe. And if you stay on to this talk on the next session, you will then understand that the kidney CKD patient at stage 3 and stage 4 have a very different dietary supplementary requirement compared with those people who are in stage 1 and stage 2. Right? Just a reminder for you, a heads up for you. So in stage 3, you will see that the symptoms like fatigue, swelling in hands and feet, and changes in urination coming up. In stage 3B, fatigue gets more severe, and the swelling will get more severe. Then you will have also symptoms of back pain, anemia, and sleep issue coming up. Right. At stage 4, which is actually when your kidney function is only less than 30%, right? Then you will have severe swelling, itchy, poor appetite, shortness of breath, muscle cramp, and trouble concentrating. These are all very serious symptoms of kidney failure, right? Of course, in stage 5, where you are in kidney failure stage or end-stage kidney disease itself, very often the patient will suffer from severe fatigue, right? Having nausea and breathlessness, confusion, and having metallic taste and seizure and so on. Let's look at the major risk factor of CKD, right? Here in this table, you can see that the older age is, in fact, one of the major risk factors for CKD, right? As for adult above 30 years old, every 10 years of progression, your risk of having CKD is 3.79, your odds ratio, which means that it's 379% for every 10 years increase in your age. So this is actually a risk factor that we cannot avoid, which means that as we get older, our risk of having CKD is definitely going higher. Next, in the risk factor side, you can see that hypertension play a very important role in actually contributing to the CKD. Hypertension, like resistant hypertension, where hypertension of the blood pressure is not controlled, even on medication, or hypertension stage 3, right? These are the hypertension patients that have very high risk for having CKD, followed by diabetics, anemia, hyperuricemia, and cardiovascular disease history, and severe sleep apnea. Right. So we will today discuss about our various important risk factors like diabetics, anemia, hyperuricemia, and sleep anemia in detail, so that you can have an understanding of the risk involved, at the same time understanding what are the corrective action or preventive action you can take. So let's look at what are the major causes of CKD. This chart here shows that diabetic kidney disease, which means is account for 43% of the cause of CKD, followed by hypertensive neurocirrhosis, which basically hypertension causing the damage of the damage of the kidney blood vessel. So these two are the major cause of chronic kidney disease. So let's look at diabetics. High blood sugar level actually directly damage the kidney, right? You can see from this chart here, right? This chart here, you can see that the red bar representing EGFR of 30 to 59. And then this is different stage of the kidney function. So in this case, typically, this is a stage 3. This is this is typically of stage 4 and stage 4, 3A, 3B. All right. So you can see from here that we compare the patient with diabetics and the patient without diabetics. These are all CKD patients. And for CKD patients that don't have diabetics itself, right, their decline of the EGFR, which is the kidney function, is about 10% in this case. Let's look at this case, right? Whereas if you are a CKD patient with a type 2 diabetic cell, then your decline of your EGFR kidney function actually is 15%. So you can see from here that high blood sugar basically directly damage the kidney and actually resulting in a faster decline in the kidney function. Another chart you can see from here is a measure of two things. One is actually the HbA1c in this axis, This axis represents the blood sugar level, right? And this axis basically, microalbuminuria is basically a measure of your kidney function. So the higher the reading itself, right? Your risk of suffering from microalbuminuria is actually higher as you go up in the risk ratio. Now you can see from here that as your HbA1c, which is your blood sugar, this is 6 is actually our normal value, right? As your sugar level in the blood increases, right, your risk of suffering from kidney damage actually increases very exponentially. So this is another indication that kidney actually is the target of microvascular damage in diabetes caused by the blood sugar level itself. So basically, if you are suffering from diabetes, one of your major complication of diabetic patient is actually kidney damage. Another way to look at it itself is that, diabetic double the risk of mortality for CKD patient. You can see from here, regardless of whether what stage of CKD you are in, stage 1, stage 2, here, stage 3, or stage 4, regardless of it itself, comparing a CKD patient with diabetics and non-diabetic patient, the risk of dying, the risk of all-cause mortality actually is more than double. So in the case of a stage 4, you can see from here, CKD patient, the risk of a CKD patient with type 2 diabetic for dying is actually about 4.88 compared with no type 2 diabetic patient, which is a risk is only about 2.08. So basically, if you have CKD and you have diabetic, your risk of dying is actually double. Another way to look at it itself is that CKD in type 2 diabetics have lower life expectancy. You can see from here, again, men and women, basically, there are not much of difference in terms of the trend, right? If you are having, for the men, for the woman, for example, if you are having CKD, as your life expectancy, as you progress from 30 years old to 70 years old, your life expectancy actually drop in this curve. Whereas if you are having CKD and type 2 diabetics itself, right, your life expectancy actually differ by at least 10 years. That means that you have a 10 years shorter life expectancy as you get older. Okay, let's look at what are the comorbidities in CKD, which means in CKD patient, what are the other common disease that they will be suffering to get at the same time. So in here, you can see that one of the highest comorbidity in CKD is actually hypertension, which means hypertension is very prevalent in CKD patient, followed by heart failure and diabetes, which I have talked about earlier, right? And coronary heart disease itself. So hypertension is, in fact, is very prevalent and very commonly found as a comorbidity in CKD. And in fact, the reason is very obvious, is because that the kidney function affects your blood pressure. So in here, you can see that, as we mentioned earlier, right, hypertension is the second leading cause of kidney failure. We have a chart earlier which shows the same, right? Now, if you look at it in terms of comorbidity of CKD itself, in fact, comparing with cardiovascular disease, diabetics, and anemia, right? Regardless of the stages of CKD here itself, from stage 1 to stage 4 to 5 here, right? Hypertension actually have the highest prevalence rate of comorbidity. In fact, at stage 4 to 5 of CKD patient, very often more than 80% of patients have are suffering from hypertension. So you can see from here, this chart also shows that how the high blood pressure damages the kidney. In here, you can see from this axis is the mean arterial pressure, which is actually your blood pressure, mean blood pressure, right? As the blood pressure increases, your kidney function, which is a measure by the EGFR itself, actually drop, right? So this is a very clear indication that as the blood pressure increases over time, you will actually damage your kidney and your kidney function actually goes down. So another way to look at it itself is to look at the proportion of CKD outcome based on the blood pressure level. So the higher your blood pressure, right, and the higher the chance of you suffering from CKD. So in this chart, you can see from here, right, the red bar represents SBP, which is a systolic blood pressure of higher than 160, which is actually a typical hypertension stage 3, stage 2, stage 3 patient, and then compare with SBP of 120 to 129, which is actually hypertension stage 120 to 129, stage 1 itself, right? So if you look at it itself, right, you can see that if your hypertension, you are suffering from high hypertension, right, then as you get older, your risk of suffering having a CKD actually goes much higher. The outcome is actually, you can see the proportion of renal outcome is actually going up much higher compared with without a person without hypertension. So CKD with high blood pressure also increases your mortality risk. You can see from here, this chart itself, proportion alive, right, over the years of 4 years itself. If you are suffering from CKD stage 4, at the third year, in fact, only less than 40% of the patient alive survive, right? Compare with if you are suffering from CKD stage 2, then at the third year itself, you are actually still at only about 75% of your CKD patient still alive. So there is a difference in actually mortality risk for CKD patient according to your blood pressure level. Okay, another risk factor that we are going to talk about is actually about gout. Gout as a risk factor for CKD. Gout is a form of inflammatory arthritis characterized by sudden and severe attack of pain, swelling, redness, and tenderness in the joints, often affecting the big toe, right? You can see from here that gout are very common in chronic kidney disease. Very often, especially when your kidney CKD is actually at stage 3 or stage 4. You can see that by the prevalence rate of gout actually shoot up from 4.6% at stage 2 CKD to close to about 30% at stage 3 itself. So gout is actually very common for later stage of CKD patient, and in fact, gout is a risk factor. The underlying cause of gout is an abnormal metabolism of uric acid. I think we all probably know that. So leading to the formation of the uric crystal in the joints and surrounding tissue, causing the pain, right? So basically, gout is the clinical manifestation of hyperuricemia, which means that when you have high uric acid in your blood, right, then this will resulting in the gout, right? So you can see from this chart itself, right, gout incidence of gout and the hyperuricemia are very much correlated, right? So you can see that based on different stage of chronic kidney disease patient, the prevalence rates of gout is very high. For instance, at stage, this is stage 4, this is stage 3, right? Stage 3 itself, the prevalence rate of gout is about 30%. And at the same time, at the stage 3 itself, the hyperuricemia prevalence rate is actually close to about 50%. So therefore, very often chronic kidney disease patients actually are suffering from hyperuricemia. And in turn, because they are suffering from hyperuricemia itself, the symptom of gout also is very common occurrence for them. So the treatment objective for gout is actually therefore the same treatment for hyperuricemia. That is actually the concentrating on how to lowering the serum urate itself. So let's look at how to deal with hyperuricemia as a risk factor. And so if we can reduce the occurrence of hyperuricemia, then we can actually manage one of the risk factor for CKD. Okay, hyperuricemia increases the risk of CKD, we mentioned already. So this is another chart showing that, right? So your serum uric acid at 420 is actually our normal uric acid value, right? As the uric acid level increases in your blood itself, right? The risk of actually hyperuricemia, risk of CKD actually also increases proportionally. You can see from here, the red line is the mean. Actually, the dotted line are basically the range of possible range of the risk factor for that. Okay, now for gout itself, actually dietary patterns have a very significant impact on gout. All right. So you can see from this chart here itself, right? If you are taking animal-based diet, right, your risk of hyperuricemia actually increases. And if you are taking a plant-based diet, actually your risk of hyperuricemia actually does decreases. So one of the way to prevent suffering from gout actually is to eat more plant-based diet itself. Another one is that you look at the gout itself. Very often when we look at the gout, we talk about food that we have to control that contribute to the uric acid itself. Now here you can see a chart that's showing various food that is increase the gout risk. Red meat, right? Seafood, we all know. I think most of us, if you have gout, people will tell you to avoid seafood, try to cut down on red meat. But reality is that fructose and alcohol are actually much higher risk factor than eating seafood and red meat itself. So therefore, if you are suffering from gout itself, it makes sense for you to control your alcohol intake and fructose intake. Of course, you should also moderately control your seafood and red meat intake. What are the food that's useful for people who suffer from gout, right? Beneficial. You can see from here that foods that can reduce gout risk are dairy, right? In fact, dairy can increase the gout risk by a lot, and coffee also by quite significantly a lot compared with soy food and vegetable. So although we say that, okay, you take a vegetable diet, it helps to reduce the gout, but in terms of specific types of food itself, coffee as a drink turned out to be a more effective beverages in helping to reduce gout, and as well as dairy product itself. Now here I want to mention, right, since we are talking about gout reduction, so vitamin C intake helps to reduce the risk of gout. So this is a study showing that as your vitamin C intake increases itself, your serum uric acid actually drop, right, itself. Of course, this itself, if you are having not enough vitamin C itself, you probably will not affect much. But the moment you have enough vitamin C in your diet itself, right, actually it helps. So vitamin C is a beneficial supplement for people suffering from gout. Okay, another major risk factor for CKD actually is anemia. Anemia is both a cause and a complication for CKD patient. I will also talk about anemia in my second part because in the second part itself, the anemia affects a lot of our dietary requirements itself. However, we cannot avoid talking about anemia as a risk factor. You can see from here that this table here shows that the cumulative incidence of anemia by CKD stage. As your CKD stage increases, right, your incidence of suffering from anemia goes up very rapidly. Now, the yellow one is actually the CKD stage 5 patient compared with a CKD stage 3A, which is a blue one itself, right? So this is the case for severe anemia. And for the mild anemia, the anemia prevalence rate are much more higher also. You can see that if you are in stage 3A, the anemia prevalence rate incidence also go up, right, as the years goes by. But for a late stage CKD patient, actually the anemia actually is very, very high. The prevalence rate is very high. So what are the prevalence rate? You can see from here, stage 1 to 2, mild CKD, the prevalence rate of anemia is about 10%. Now, stage 3 itself is already 20 to 40%, which means that on average, about 30% of the CKD patient will suffer some form of anemia. And in stage 4, the anemia is almost 50% of the patient will suffer from it. And in later stage itself, very often, most of the patient itself will suffer some form of severe anemia. Now, anemia also is associated with increased risk of CKD progression. And that's why what we are saying. So if you have anemia, right, you have increased risk of CKD compared with non-anemia. So you can see from here, right, that all-cause mortality for CKD patient itself. If you are a CKD patient that not suffering from anemia, your survival probability over the years is at the yellow chart here, yellow bar here. Compare with the red line. The red line indicates that you are CKD patient that's suffering from anemia itself. So you can see that the survival probability are much more lower over the years as the disease progresses. Another risk factor we're going to talk about is actually obstructive sleep apnea. A condition which the airways is blocked. You can see from here that the normal sleeping condition is that the airway is still flow through our throat here, open airway, right? But if you're suffering from OSA, right, your airways is actually blocked and resulting in actually what we typically know as snoring, snoring itself. Now, this is quite common in a lot of countries. In Singapore, the prevalence rate is about 30%. There's a study indicated that it's about 30% of the Singapore population suffer a moderate to severe OSA. Okay, let's look at the OSA in relating to CKD patient. How prevalent is it? This chart shows that the OSA increases the risk of developing CKD, right? You can see that the red one represents the patient that's suffering from OSA, and the risk of actually CKD is higher than people that's not suffering from OSA. Okay. What are the other risk factors itself, right? So actually, there's another study indicate the odds ratio. CKD risk actually for OSA patients who are suffering from moderate to severe OSA, actually the CKD risk odds ratio is about 239%, right? Lower EGFR, which is also an indication of lowering of the kidney function, the risk is actually 1.6 or 160%, right? And kidney dysfunction is about 170. All this basically point to the facts that if you are suffering from OSA, basically you have higher risk of suffering from kidney dysfunction. Okay, now OSA itself, here I just want to give you a practical guideline to if you are suffering from some form of OSA, it can be a mild form, and a lot of us are actually to some extent one of the indication of actually whether you're suffering from OSA or mild form OSA or not is actually the snore. If you snore loudly and you snore badly, and sometimes you feel that when you sleep, there's an obstruction of it itself, to wake you up, means that you're actually suffering from some form of OSA. And for mild OSA itself, basically, you just have to, the treatment actually is on lifestyle changes itself, exercise regularly, quit smoking, lose weight if you are obese, right? And then avoid consuming alcohol at night, and also avoid sleeping pills, sedative. Those are the action that you can take to actually relieve yourself from mild OSA. But if you're suffering from moderate OSA itself, one of the approach actually is the position therapy, which means that preventing yourself from lying in a supine position, which is face up position. What you do is that you want to promote the side sleeping. Sleeping on the side itself, lateral posture is one of the way to overcome a moderate OSA itself. Of course, if you're suffering from severe OSA, you really need to seek therapy itself. Then one of the golden, what we call standard for treatment for this is actually CPAP, which is a continuous positive airway pressure technique itself. You can see from this picture. Okay, what are other risk factors that can affect CKD patient, right? Medication is one of the factors that we often are not aware of or ignore, but it's very important, especially some of the medication listed here. NSAID, which is actually non-steroidal anti-inflammatory drugs like ibuprofen itself, they can damage your kidney, and therefore you should not take it unless it's necessary. These are pain reliever, anti-inflammatory pain reliever. Another very common medication for GERD, which is the gastric acid reflux diseases condition, is actually proton pump inhibitors, PPI. So in here itself, this PPI medication are often required to be taken continuously over a long period. Unfortunately, PPI can also affect your kidney. So therefore, people who are on long-term PPI medication should go for regular kidney function checkup. Antibiotics also can damage your kidney. So therefore, be careful about antibiotics medication, right? Chemotherapy, especially cisplatin, platinum-based chemotherapy drugs, of course, also can damage kidney. And therefore, very often you find that a patient undergoing chemotherapy itself, they also have to monitor their kidney function. Other kidney agents that can actually damage kidney are ugly chemicals, alcohol, smoking, and heavy metals like lead and cadmium as well. Okay, just give everybody a summary, right? How to reduce the risk of CKD? Now, primary prevention strategy in high-risk patient, right? First, avoid all the medications if you can, as I mentioned in the previous slide. Second is that go for regular checkup, monitor your kidney health. This is very important. So if you have a high risk, you should not actually skip your regular checkup of kidney function, because a lot of kidney problem cannot be detected through symptom alone. You really have to actually a regular checkup on urine analysis as well, the blood test itself. It will give you a much more accurate presentation of your status and kidney function status. Also very important is that we already mentioned all the major risk factor that can affect kidney, and therefore it's very important that once you have those risk factor, you must know how to manage it, right? So I did not mention any of the solution for hypertension, management of hypertension and diabetics, because these are two big subjects that I have talked previously, and therefore I will leave it for you all to go and refer to those preventive action that you can take, and a dietary strategy you can take, or lifestyle changes you can take for people who suffer from hypertension and diabetes itself, right? We will talk about how to handle the anemia conditions in next talk. And for gout and hyperuricemia, we just mentioned. So therefore, control based on your diet, take the right diet and avoid those gout causing diet itself. Okay, now it comes to a product that I want to talk about on Otomi. The product Hemohin is Otomi's world-leading product, and Hemohin is actually Otomi's top sales product. Now, why I talk about Hemohin is because Hemohin is very closely related to its function of able to treat patients that suffering from anemia and low immunity. Okay, the story of Hemohin development. Hemohin is developed as functional biodefense food for people dealing with radiation. Basically, in Korea, Hemohin was actually developed for people working in nuclear power plant. People who work in nuclear power plant very often suffering from the risk of radiation, risk that can damage their health. So therefore, Hemohin was developed as a biodefense food to protect people from radiation damage. Now, what Hemohin stands for? You will notice that Hemohin, the words itself in the label are very different. So the hemo, actually the HEMO are not all full capital, and HIM is full capital letter. So hemo itself stands for hemoglobin, basically represent a protein in a red blood cell that carries oxygen. The big capital letter of H stands for hemopoiesis, formation of blood. Basically, it's a term indicate the formation of blood. I stand for immune, and M stand for modulation. So in short, you can see that hemoglobin, hemopoiesis, immune modulation is actually the representation of Hemohin. And this basically summarizes the overall major function of Hemohin. In Singapore, Hemohin is a medicine. Right, so you can see the information in here. There's a CPM license for listing itself, right? And because it's classified as a medicine in Singapore, especially it's classified as a Chinese proprietary medicine in Singapore, every batch of Hemohin, right, in Singapore must be independently tested for safety before it is approved for sales. So there is a guarantee of a product in Singapore that is undergoing a test that is making sure that everything is safe before you are allowed to allowed for sales itself. So in here, because it is registered as a CPM product, a medicinal product, it is also regulated by the HSA. That means that we cannot simply advertise. At the same time, also seller must be an authorized seller itself, cannot be an unauthorized seller. What is Hemohin pharmacology? Right. So modern pharmacology of Hemohin based on actually the published paper in PubMed. PubMed is the US National Center for Biotechnology Information Database. In here, you can see that I've listed out all the clinical study paper related to Hemohin. Hemohin have 2 published clinical trials human study paper, 17 preclinical study paper, and 2 toxicity study paper itself, right? To summarize all this, right, basically, what is the pharmacology of Hemohin? The main pharmacology of Hemohin is actually hematopoiesis, which is blood generation. immune modulation, which means that immune not only is support, but also immune regulation. It's immune regulation, anti-fatigue, anti-inflammation, and anti-radiation. These are the major pharmacology of hemohin. Okay, now ingredients composition of hemohin basically is very straightforward. It's composed of 3 traditional Chinese herbal medicine, and it's a classic herbal medicine. They are the Agarega gigas, Cnidium officinae, Pannonia japonica, which in Chinese is actually Tang Gui, Chuan Xiong, Bai Shao. This is their composition per sachet. Now, if you look at the composition of hemohin, right, and if you want to understand what is hemohin normally able to use for, I share with you a comparison of hemohin with one of the TCM classic hematopoiesis tonic. So this is actually the hemohin composition, as we mentioned earlier. Then we have another TCM classic Suvisop. Suvisop itself, actually the composition is very similar to hemohin, except that there's an additional ingredient, is soti, Rehmannia, which is actually not is absent in hemohin itself. Now let's look at Suvisop, because this Suvisop is used in TCM treatment for blood deficiency and has been used for centuries. Centuries is one of the most classic tonic, hematopoiesis tonic in TCM, actually, what they call product itself, right? So the Suvisop itself in the modern clinical indication for TCM treatment is actually, they are indicated for anemia, low blood count, and menstrual irregularity. So therefore, if you understand that the hemohin is very similar to Suvisop, then you can also indirectly relate it to the function of hemohin in application, modern application. Hemohin can be used similarly as Suvisop in the clinical indication of anemia, low blood count, and menstrual irregularity. So what hemohin can do? Therefore, hemohin as a hematopoietic therapeutic for low blood count. As we mentioned, based on the understanding, hemohin actually able to help to relieve symptoms of iron deficiency anemia. Right, so this is basically when you have low number of red blood cell or iron deficiency caused by causing the anemia itself. But hemohin cannot be effectively used for genetic disorder anemia like thalassemia or sickle cell anemia itself. So they are effective for iron deficiency anemia, but they are not effective for thalassemia. Okay, so what are the symptoms of iron deficiency anemia? Basically, normally if you're having such as anemia, we will suffer from fatigue, shortness of breath, and paleness itself. Another function that hemohin can do is actually hemohin as an immune modulating therapeutic for low immunity. Hemohins help strengthen body's immunity, so prevention of infections, radiation side effect, like we mentioned earlier, the original purpose of hemohin development is actually to prevent radiation side effect and slow wound healing. These are all immunity functions. Beneficial for persons suffering from immunity deficiency diseases like cancer patient, AIDS patient, and singular cell. So hemohin application in the overall context itself, if you use hemohin as a supplement for optimal health maintenance, right, it is indicated for people suffering from fatigue and immune support. That means that you want to take hemohin as for you're suffering from fatigue or you want to boost your immunity itself. The dosage is normally 1 to 2 sachets per day. But if you want to use it as a therapeutic, which means they use it as a medicine, the dosage for the medicine will be higher than the normal dosage of maintenance, right? So in this case, you can use hemohin as a medicine for anemia, low immunity, or low white blood cell, or for person who just suffer from surgery and require from surgery recovery and radiation recovery. So in this case, the application dosage can be up to 3 to 4 sachets per day itself. Right? So hemohin generally is safe for long-term consumption. There's a study on hemohin, toxicological study. I'll leave it for you all to do a reference. But generally, based on this, basically what you are saying is that if you are taking at 2 sachets per day, long-term consumption, there is a very high safety margin provided. All right. What is important for a lot of people is that while we understand and hemohin can be used for a lot of applications like low immunity and anemia conditions. So there are also actually a lot of user and members of Atomy members outside there claim that hemohin can be also used for a lot of other conditions. Now I want to here highlight for everyone that when you recommend hemohin, right? If you are recommending hemohin under healthy person, normal condition, there's no problem on that. But there is a group of person that is suffering from this condition like hypertension stage 2, or you are suffering from CKD stage 3 or 4, or you have impaired liver function or liver diseases, then this group of people should take precaution and be careful about the dosage they take with hemohin, right? So before they take hemohin, this group of people should be very careful. They should start with low dosage and see whether there's any changes in their health conditions or their particular conditions of disease condition they're suffering, right? Then there's another group of patients that I will advise against taking hemohin. These are people that are suffering from breathing risk, people who suffer from aneurysm, people who suffer from severe hypertension, which is higher than SBP of 180 and DBP of 110. Pregnant ladies, children under 6 years old, people who suffer from CKD stage 5, right? And people suffer from severe liver disease, cirrhosis itself. So these are the group of people should abstain from taking hemohin or should not be given hemohin, right? Okay, this is the end of my session. I will pass the time back to Pauline.